So could you please explain the different stages of cancer and different treatment modalities in brief? Also, and what are the promising new upcoming remedies also for the same?
So you've asked me to give a basic speech in general, but yeah, I think it's important to know the stages. Stage 1 is where the tumor is less than 2 centimeters in size and confined to the breast. Stage 2 is when it's between 2 and 5 centimeters and it has spread to the under the armpit, but in a very limited way. Stage 3 is when it's bigger than 5 centimeters. It has spread quite a bit to the armpit. It has spread over the collarbone to the nodes, as we call them. And there are some nodes inside the breast. It has spread there as well. So that is stage 3, which is still confined to the breast area. Stage 4 is when it has gone out of the purview of the breast area and has gone to the bones, or to the liver, or to the lung, or to glands in our abdomen, or to the skin, and very rarely to the brain. So when it affects other organs rather than the breast, then we call it a stage 4. Now, as you can imagine from the staging that I've talked about, stage 1 is 95% curable, brilliant results, 97% even cure rate in some subtypes. Stage 2 is about 85 to 87%. Stage 3 drops, and it's between, it used to be 30%, but now it's up to 50% with the new treatments. And stage 4, I'm happy to tell you that there are different types of breast cancer. Okay, so breast cancer is not one disease, and it depends on certain buttons secreted on the top of the cell called estrogen receptor, progesterone receptor, and the HER2 receptor. The estrogen positive receptor stage 4s are living for 5 and 6 years on an average, could be even more. The HER2 positives are living for as long as 8-10 years with good treatment. And this is again an average. I have patients with stage 4 HER2 positive, been on treatment for 7-8 years, don't look like patients anymore, are, like leading a normal life. And the only question to me is, Doc, when can I stop the treatment? And I ask this to my colleagues abroad, and they say, we're scared to stop the treatment because they all have patients like that. We all do. The problem is the triple negative subtype, which is negative for everything. That tends to come back, and when it is stage 4, then the situation is a little tough, and we are making a lot of strides in that as well. The next question ma'am asked me, what is new on the horizon? So it's a very exciting time for breast oncologists and people who treat breast cancer. And we have a whole new group of drugs called antibody drug conjugates, ADCs. What is this? So just like you have a vaccine where you use an antibody to block the antigen or the foreign body, the same way we have antibodies to block the receptors, as I mentioned, those buttons on top of the cell. We are now clever enough to link the chemotherapy onto that antibody as a technology. So we are able to deliver the antibody directly to the tumor cell, which has the button, the receptor, and the chemo, and then it gets into the cell, and the chemo detaches from the antibody and is delivered inside the cell. So we are able to now take the chemotherapy in a clever fashion right to the tumor cell and let it get exposed directly inside the cell without harming the normal cells around. So these ADCs are the future of breast cancer and many other cancers, but they've come up in breast cancer in a very, very big way. The other advance is immunotherapy. Immunotherapy is also delivered by the antibody technique, but what does it do? It stimulates our own body's T cells, which are the fighter cells which have gone to sleep because of the cancer. They get awakened by these antibodies and they start getting ready for battle. And 10 soldiers produce 100 soldiers due to this antibody, and they start recognizing the tumor cells. They wake up and they go and kill the tumor cells. That is also becoming. very big in cancer care. So yes, it's a very exciting time for us.
Right. Very true, ma'am. What role do you think does genes play into this? As we know, there is a very high genetic predisposition for the concerned disease, ma'am.
So all cancer is genetic. It is due to some abnormality in a gene that has happened due to bad diet, bad hormones, environment, and a lot of other factors. But only 5 to 10% of cancers are hereditary. That means passed from parent to children. Remember that breast cancer can be passed from a bad gene, can be from the dad or the mom. It doesn't have to be the mom. And not all children will get it because we inherit half our genes from dad, half our genes from mom. So there is a 50% chance if our parents, either of our parents, have that bad breast cancer gene, which comes with ovarian cancer, there's only a 50% chance that the child will get it. Now, you've all heard about the Angelina Jolie story. So 5 to 10% of all breast cancers are hereditary, and this is most commonly attributed to the BRCA1 and BRCA2 gene. Angelina Jolie's mom had BRCA positive ovarian cancer. She then tested for it. She found she was a carrier without the cancer. Then she opted for bilateral breast removal, prophylactic mastectomy, and followed by oophorectomy. So she prevented the cancer in her by removing the organs. So this is a drastic step, but it's foolproof. All right. So we did an Indian study to see how many of our patients are hereditary. We did a BRCA study. The conclusion, and it's being presented in Europe, this poster next week, is that in the triple negative subtype, almost 15 to 16% are BRCA positive, hereditary. In the ER subtype, it is about 6 to 7%. So it is a large, so almost overall 9% of our breast cancers are hereditary. So we must do this testing for a lot of our breast cancer patients.
So there are these testing modalities for the
It's
gene
a blood
testing.
test.
Right.
It's done by 3 ml of blood. You get the result in about 3 weeks.
As we all know, this requires a lot of support from the family and friends also during the course of the disease. So what kind of psychological support does the patient need from family and the relatives or the society in general, ma'am?
Yeah, so that's really paramount to address. And the emotional part and the mental part of the patient often gets neglected in cancer care. Like I'd really like to say that in India, I'm so proud and happy that the family system still exists. When we train abroad, we see patients coming alone for chemotherapy. And then when we ask them where their children are, I haven't seen my daughter for 2 years. And they're driving themselves to chemo and they're driving themselves back. Our situation, thankfully, is quite different. We have a very strong family support. And sometimes the relatives are more scared and worried than the patient themselves. So I find in general, families are very supportive, but they also break down because they have to be brave in front of the patient and they can't really disclose the turmoil or the anxiety that they're going through. Of course, it is a social, people still regard it as a social stigma, but please, it's not your fault that you got cancer. It's really not. And I think society has to be more supportive of such patients and not go in and give their two-bit advice and be negative. The last thing you need to do is be negative around cancer patients. You need to be encouraging, you need to be respectful, and you, just because you've heard something from somewhere, you don't need to repeat it in front of the family. So please be careful about that. So yes, we do have support groups for caregivers also. There's a lot of information online. There are helplines available. The oncologist, as in India, also considers the family while talking to the patients. So I will very often spend time with the parents or with the husband or with the children, telling them the situation, preparing them for the worst, the best, and also basically telling them how to manage the few side effects that the patients may go through. So I think family support is very important. Most hospitals now have psychologists attached to the cancer centers. I think this is a very good initiative, and if more of that can be arranged, we have them visiting the daycare, we have them visiting the families. We also arrange home visits sometimes when the patient's not able to come. So there are a lot of trusts and foundations doing that work, but we need more volunteers and more support for that. Yeah.
There have been some myths around or misconceptions around breast cancer, ma'am. Could you
Yes.
clarify on some?
So the first one is, if I wear a black bra, I'm going to get breast cancer. I swear I've heard this. Please, nothing, no truth associated with that. Underwire bra causes breast cancer. Certainly not. Underwire is good support for women with large breasts, but remember, loosen it at night. Allow yourself to breathe properly. That's important. Deodorant causes breast cancer. No. Yes, it's a chemical. Try and use a more organic one, but certainly it does not cause breast cancer. There have been some studies with hair dye related to breast cancer. These have been the high peroxide ones. But just remember, when one positive study comes, a few months later it is followed by a negative study. Then again you get a positive study, everybody starts freaking out. Then a year later another negative study comes. So there is no concrete proof that any of these can cause breast cancer.
Thank you so much, ma'am, for enlightening us and
Not at
for reinforcing and letting us know all the
A
most
pleasure.
important.
Thank you.
Hope you all will apply the knowledge to oneself and educate your family and friends, and increase the awareness in the society, and implement these screening preventive measures for yourself and encourage the others to do so. Pledge to take the screening for yourself and your family members. Thank you.